I'm Alessandro Legouix. This is Mindset Unfiltered. My guest this week is Alessandro Carmelita, Italian psychologist and psychotherapist who has worked with some of the world's most elite athletes and is working with a number of athletes who will be heading to the Tokyo Olympics. A few years ago, Alessandro started to develop a fascinating new technique called Mindful Interbeing Mirror Therapy. I'll let him explain it properly, as he does so far more eloquently than I ever could, but it really is extraordinary, and clearly is and will continue to help not only athletes, but everyone who wishes to cope with or recover from trauma, any form of emotional pain, any difficult experiences, body dysmorphia, dealing with the chimp brain, and so much more. And it's not just focusing on the negative, but more activates and enhances the brain's positive thoughts. He has a brilliant analogy that he uses at one point, which is if you imagine oil in the top of a glass of water and the oil is the negative, and if you try and scoop the oil out, it's so hard, it's impossible. However, if you keep filling the glass up with more water, then eventually the water overflows, carrying the negative, the oil, away with it. I just love that analogy. I think that's a really nice concept. The idea is that this is creating new neural connections, new instinctive reactions to an underlying problem and modifying your negative memories. I strongly urge you to give this a go, and currently Alessandro is very kindly offering my podcast audience one free session, which is so generous. So do email him on info@mirrortrainingmethod.com and do let him know that you came via me, alexlegouix. This is Alessandro Carmelita. Alessandro and I tried to do a podcast at the very beginning of what had just started being lockdown, hadn't it? And that was sort of pre-sussing out technology and all of those things that this weird circumstance has forced upon us to fix. And also what Alessandro's technique relies on is a mirror, which also is not so easy, but I'll let him explain all of that. So we might as well start, Alessandro, with you actually explaining who you are.
Yes, sure. So I'm a psychologist and a psychotherapist, and I've been working with patients, but also with professional athletes for almost 20 years. I'm Italian, and I've been working for 18 years in Italy, and then 17 years in Italy, and then I moved to London, and I started to work here in London. So I was originally trained in cognitive behavioral therapy, and I was trained in Italy, but also I went to Philadelphia to do an intensive training with Aaron Beck, that was the father of cognitive therapy. And then I tried to learn many more approaches, and suddenly 7 years ago I developed a new approach called Mindful Interbeing Mirror Therapy, that is a therapy for clients that were not really responding to other therapies. And also for clients that are having very difficult problems, or emotional and psychological problems. And then because I was already working with professional athletes, I adjusted some of these techniques that I've created for patients. I adjusted them to work with professional athletes, and then I started working with them with a large mirror. I was working both with patients and athletes with a large mirror. We were in front of the mirror, and I started to use everything that I learned from other approaches. I put everything together in a different way, and I created something totally new that was defined by some of the best experts in the field of psychology and neuroscience as revolutionary, because using the mirror is really giving the possibility to do experiences that in a regular setting is difficult to really do. And so I started with that, and it was very successful, and everything was surprising because it was successful and very fast. And at a level that was not even possible to think about with a regular approaches. So I was so excited that I get another colleague involved, and we worked together, and we kept improving all these techniques, and we tried with many different persons with many different problems. And so we continue to work with clients, with patients, and I continue to work with, at that moment, with different athletes from different disciplines. And it was great. They were achieving things they were not able to achieve before, and they were really happy, and I'm still doing it. Now I'm working with English, even if it's not my language, but I'm working with English patients and English athletes, and some of these athletes are going to, they had to go to Tokyo, but they are hoping that the federation will not change, the organization and world organization will not change the results of, because they were able to really be included in the representative of the countries. So they are athletes from different countries, and they are hoping to be able to go next week, and then next year to Tokyo. Not next week. It would be nice next week.
So talk us through the system, the method.
Yeah. So I stay usually in front of the mirror with the athlete or with the patient, and I use different kind of techniques that are related to the eye movement. So I tend to ask to the client to do what we call the mirror mapping. So we map the mirror in which term. I ask to the clients to move the eyes in different parts of the mirror, and notice what happens inside of them. So usually when they move the eyes in a certain area of the mirror, very frequently is the bottom of the mirror on the left. They feel that they are activated emotionally more than usual. And when they move their eyes up into the mirror, they feel very frequently that on the top of the mirror, they feel less activated emotionally, and sometimes they feel also to be more energetic and stronger. And for some clients, it's the opposite. It's like right in the mirror on the bottom, it activates the more emotions or emotional feelings, and with them many thoughts about moments of many memories about moments of their lives in which they experience strong emotions. It could be, for patients, it could be difficult moments, or for athletes, could be moments of failure in their performance, or moments of it's not just negative. We see that they are activated emotionally, also in a positive way.
Right.
So we do this mapping of the mirror, so we know that when they move their eyes, we are in a certain area. We are actually of the mirror. We are actually activating some internal states, emotional states, but also we are activating different areas of the brain.
And is that to do with how they are mapped in their own minds? What is it that's making those, we know that if you look at someone and they're asked to remember something, they look up to their left or something. Is that right? Is it that sort of thing that is triggering?
The research show that the eyes are directly linked with the brain. So when we move the eyes in a specific part of our visual
plane
field, we tend to activate a specific area of the brain. So we are using this in order to elicit more emotional states. So and sometimes we use that to give to the client the possibility to have access to positive emotional and physical states. So we can introduce that, activate those states at the right moment when we need them. So the mirror becomes like a dimension in which we try to create to put the right ingredients. So we try to activate certain emotional states in the person. And then we move the attention of that person and the eyes of that person and in a specific way, so we can really introduce the right ingredients at the right moment when the specific areas of their brain are activated. So we know that our brain is always really creating new neuronal connections. So also when the client is with us, if we help them to activate certain areas of their brain, and then at that moment we allow them to do new experiences, we are creating new connections that usually when we say that when neurons fire together, they link together. So these new connections, because also the other those areas of the brain that are really activated because they are feeling those emotions or their feelings are activated. So these neural connections link together, and we create new paths of neural connections. So what does it mean? It means that when they will be in a specific situation in which usually they feel certain things, or they live or perceive those situations in a certain way, not only all the neural paths are activated, but also the new neural paths. So it's like being able in a systemic way to introduce the right ingredient at the right moment in their life when they need it.
Wow.
So we see, just to be practical and say something. So for the athletes, let's talk about athletes. So we start thinking about a negative moment of their career. And so we start to see the negative moment and as if it was happening at the present moment.
Yeah.
So when they do that, we ask them to move their eyes in the area that activates more emotional states. So we know that we are activating certain areas of their brain. And at that moment, when we activate those areas and we help them to have these memories coming up, then we ask them to move their eyes to themselves in the mirror. And then we ask them to move their eyes to the areas in which they could feel something positive. So we are doing different things. We are trying to activate certain areas. Then we go to the present moment. So you are the one that you see in the mirror. So they go back we help them to do there's a technique that we call the body scan with divided attention. Yeah. So they learn to divide attention between what they see and what they feel in their body. So they learn to do that, and when they move the attention from the past to the present, and they start to really feel their body and explore their body, they are introducing something in that memory that was like a package that was closed and was not possible to be modified. So they're introducing something that is related to their present state and what they are living in the present. Then we move their eyes to the areas in which the other areas are activated, the areas in which that are activated usually when they feel stronger and they feel positive feelings. And so we are introducing also another ingredient. We could also ask them to look at us at that moment and see and connect to us, and we try to feel inside of ourselves something they can really see through our eyes. So we are introducing our feelings in what the person is feeling. And when we ask them, what do you feel? What do you see in my eyes? And then the person could say, oh, I feel you confident. I feel you strong. Okay, could you feel it in a certain area of your body? Yeah, I can feel it here. So could you just stay there? Just look at that part of your body and try to feel it. Try to feel this confidence inside of you. So we are, again, trying to help them to be aware of that and introduce something through us, because they were seeing that in us, and then they start to feel that inside of themselves. Why they're starting to feel that inside of themselves? Because their mirror neurons, the mirror neurons are neurons that are really unique. They were discovered from a group in Parma. Actually, I know one of the scientists that discovered them, Vittorio Gallese. The mirror neurons are specific cells of our brain that really help us to feel what the other person is feeling. So they at that moment they cannot feel confident, they cannot feel strong for themselves, but then they connect to us and they pick up what we are feeling, pick up what we're feeling, and they start to feel that inside of them. Then we ask them to pay attention and give space to that. So it's like, when you go to a physiotherapist and you cannot do a movement, and the physiotherapist is trying to make you move. Yeah. And then gently you do that, and then you become able to move.
That's it, because the speed that we reflect what we see in people's faces is incredible, isn't it? Because we want, and that's where that communication can sometimes get marred, because what you're trying to say to someone or how you're trying to explain to someone, we must read expressions so quickly that if it's not reflecting what emotion we're trying to convey when we're speaking, then it can really change things, can't it, in our brains? Because presumably that's how we learnt as babies.
Yeah, exactly. We see that what I found and what we developed with my colleague is something that is really able to activate specific areas of our brain that were activated when we developed our inner self. Yeah. So, and the inner self, we start to develop the inner self. When at the same moment in which we start to recognize ourselves in the mirror, actually the process of recognizing ourselves in the mirror is a very key aspect of the creation of who we are. So we start recognizing first our mom or our significant other, the person that is taking care of us, and then we recognize ourselves. And we, as a human beings, when we are children, we are like a totally undifferentiated human being at the beginning, and then we slowly start to create bonds and to define who we are and who the others are. So we start to see, oh, I'm not her. Actually, I'm Alessandro. So I can, at that moment, we start to recognize ourselves in the mirror. But we know that the first experiences in our life, when we are creating really the basis for who we are, sometimes we could have difficult moments, relational problems, emotional problems, and then we can see that there are many ingredients are missing: emotional ingredients, relational ingredients, but also it could be those emotional and relational ingredients could also be related to how we perceive ourselves. Also, how could we perceive our body? So it's very easy to understand that when we think about the eating disorders, or those people that are obsessed about their body or about their muscles. They have this distortion. They look into the mirror and they see themselves as skinny or like they want to have more muscles. Even if I look at them, I see like that they are bodybuilders, and actually this is a problem of many bodybuilders, but they see themselves as tiny or skinny, and they would like to become even more
built up, or someone basically like them, like the person they're envious of.
And so the thing is that we are activating, when we work in front of the mirror, we are activating certain areas that were involved when the person created his own inner self. So we are really going deep, very, very deep. So and it's and the surprising thing is that it's so fast. So it's very common to see one person that we were working with for a while going in front of the mirror and be able to do in 10 minutes what we were trying to do we have been trying to do for 2 years
with the other system. Minutes. What about because the thing that sort of jumps to my mind, and a bit like what you were linking there with things like anorexia and body dysmorphia, is that most people, or a lot of people, are really uncomfortable looking, because it's a very vulnerable act, isn't it, to look at yourself and really look at yourself in the mirror, and also to really look at you would be quite a nerve-wracking thing.
Exactly. So this is really important, because what I was really surprised at the beginning was how difficult it was for everybody to look at themselves in the mirror.
Even like I would consider myself quite a confident person, and I don't have major hang-ups. There's not a lot of sort of anxiety that comes around looking in the mirror, for example. Not that I enjoy it, but it's like, but it would still, for me to actually have to really look,
and also have to with someone else that is also looking at you at that moment,
and not have that, because we're trained to not, at least not show that we're pleased with what we see. It's such a negative connotation to be confident about who you are and who you look like. It's so bad, but it's such a negative. People assume that you're arrogant if you like what you'd see in the mirror. And yet you're like teaching people to make peace with what they can see.
Absolutely. And not only that, we are really going deeper and deeper, trying to work on everything that is really affecting in a negative way their lives and their performance if they're athletes. So but as you were saying, it's so difficult to look into the mirror and see that ourselves. So I was really surprised that I wasn't expecting that. And many people become really emotional very quickly.
Right.
And what immediately we can see is that there are many things that starts to happen very quickly. So they see themselves and they can start to cry sometimes, especially if they have emotional problems. They can start to cry, And then suddenly there's also something else that happens. There is a side of us activates, and it's the side of us that we call the other, internalized other. So we see ourselves as someone else was seen us, as being seen us for a long time. So we start to say, oh, I hate you. I hate that person. I hate that person. I hate that person that is crying now. So it's like a side that is critical side, the judgmental side, is coming up and say, oh, you are terrible. I mean, you are weak. You are a disaster, and all those negative things. And what we try to do is to really notice that and try to, at that moment, introduce something new. And what is this aspect, something new that is really important? Because this is another internalized, we're trying to make the client have a new experience with us, in a relational experience, in which this person can find that ingredient that was missing at the moment in which he was probably very young and he was criticized for not being perfect or not being emotionally good or whatever. And so we try to introduce the ingredient at that moment, relation. So we ask them could you look into my eyes? What do you see in my eyes? So when I ask them to do that, and they are judging the other side, the internalized other is activated, they look at our eyes, and what I try to do is I'm the first tool of the process. So I need to create inside of me to really be able to open myself to that pain, to that suffering, and feel inside of me compassion. Yeah. So so compassion. What I mean for compassion, I mean really feeling the pain of that other person, and feeling that I would really like them to be free of that pain. So it's a very it's something that I can do if I allow myself as a clinician or as a sports psychologist to feel their emotions. So they can see in my eyes compassion. They can feel that something totally different from what they were feeling for themselves. Yeah. So they could say, "Oh, I see that you're feeling sad for me, or I feel that you're feeling compassion for me. Could you feel it in your body?" So we are trying to introduce that through us, to introduce that ingredient that was missing. So what I say is, usually is, if there are athletes, there's something that is emotionally, psychologically, that is stopping them to be able to perform in the right way, to be really there at the right moment. And we try to understand what is that, and we try to introduce the right ingredients. And it's actually the same with clients, with patients. And what I say usually is, you don't have to fight the internalized other. We're not fighting anything. I'm not gonna fight a side of you that should not be there. It's not that. I mean, that side has to be there. That side is an ingredient of your inner life. But the problem was that something was missing in your life. So that side took over and took all the space, and is always there, and stopping you to really perceive the things in the right way, or feeling in the right way, doing in a way that you can enjoy what you're feeling, or that can really make you feel that you are free, that you're choosing to do that. So we try to introduce the new ingredient, the compassion ingredient, more and more and more, instead of fighting. And usually the example that I use is, if you put some oil drops in a glass, and with a bit of water, the oil goes up, and if I say to you, take all the oil away from the water, and you try to use a little spoon, and you try to take all the oil away, but you also took a lot of water. At the end, the oil is still there.
Yeah.
So, but what if you put the glass under a sink and you put more water, and you keep doing this, and then all the oil just goes out, and then you can take the water and drink the water because it's free of oil. So you try to put more of good instead of fighting the bad that is inside of you. And we keep doing this, but for some of them, the new feeling or the new experience that they do just once could be like revolutionary, like, wow, what is that? I never felt something like that. I was never able to do that. Obviously, with athletes, I introduced many more other things. The therapy is not just that. We have many different experiential techniques in front of the mirror, for patients, but also for the athletes. But for athletes, I also introduce other new techniques. First of all, I didn't talk to you about the dot. One of the first things that we do is to put a dot on the mirror in the area that corresponds to the mirror image of us. Yeah. So between our eyes. The person is very close to the mirror. The person is sitting down. If the person is a patient, usually with the athletes, they are standing, because we do also some warming up. We try to raise the heart beating, because that makes a difference for the athletes.
Yeah. So under a stressed state.
Yeah, exactly. You need to take the heart beating high, so you can really work on in a real, like as it was a real situation. But so we put this dot. Their knees are touching if they're sitting down the mirror. So when they see themselves, they can only see the mirror image. They cannot see their body because their body is down here. They cannot see that. They just see the image. And they're also very close to the dot. So the dot is in front. And I ask them to look into the dot, and they start looking into the dot. And their eyes are converging to this area. And when the eyes are converging in the middle like this, what happens is that there are many things that are happening. So they are activating the vagal nerve. And so their heart beating starts to slow down. Their muscles starts to relax. So they start immediately to feel relaxed. And we developed this method just from an observation that I had in front of the mirror. And then I tried, and it was very useful. And then I learned from that there's a specific therapy that is used for panic attack, in which they put like a very close object, and you have to watch this very close object in a way that the eyes are converging. And after a few seconds, you see that your eyes cannot converge anymore, and the focus blur. You are not focusing anymore the dot. You're focusing something else. In this case, because we are using this in front of the mirror, is you're focusing maybe on your image reflected in the mirror, or on everything that is beyond you, but actually that in the mirror is in front of you. Yeah. And then we ask, okay, just notice that and go gently back to the dot. So we call that, for the therapy, we call that Mindful Interbeing Mirror Therapy. Mindful because it's all the time a mindful way, a mindful experience. We are always doing a mindful experience. We are in front of the mirror. And so I was saying, when you go back and you do, automatically your eyes lose the focus, and your external eye muscles are not able to be contracted anymore. So they relax, and then you lose the focus, and then you go back. You do this, broadening and narrowing all the time. And after a few seconds, you feel, wow, oh wow, what is this? You start to feel like what we call the controlled dissociation. So you start to feel both subject and object of your experience, and it's like as if that person in the mirror was the real one. Remember that you are not seeing your body. You're not looking at your body. You're just seeing your body in the mirror, and you're doing this. And that, why we do that? Because we saw that when you do that, then it's much easier for them to really activate their emotional states and do many different experiences that otherwise it would be very difficult for them to do. So it really speeds up the process. It speeds up the process. And also, the dot could also do something else. So when you converge your eyes on a closed dot, you see what you are doing is we know that the right eye is connected with the left hemisphere, and the left is connected with the right hemisphere. Mm-hmm. The right hemisphere is the one that is more related to emotional activation, everything that is related to also to creativity, to the art, everything that is more also related to feelings is that. The left side is more rational. Mm-hmm. It's more something that is goes to another level. Yeah. So it's more practical, more. But both hemispheres are really important in our brain. So when we converge, we are activating both hemispheres at the same time because the eyes are converging and so we use that, staying a bit longer on the dot, to really make these two hemispheres be activated at the same time and integrate a certain experience that the person could have done maybe a few seconds before. So we do like all a practice. It could be short or longer practice, and then we say, okay, stay on the dot, and they integrate that. So many things are happening very quickly, very quickly in their brain. We're shaping their brain. So it's very, very fascinating. And the first thing that I thought was, wow, I can see how many things that could be really studied through researchers. Yeah. So it's a totally new field of research. So there was a big expert in the field of trauma, and she said, Alessandro, this is really changing everything we know about trauma and how to work with that. This is really revolutionary. She tried in front of the mirror. She said, wow, I can see how powerful it is. And she's a therapist, and she's also a neuroscientist.
Is this something that people can tap into as well when they're not with you? Once they've got the technique, then they can access it, and then that can become something that they work on themselves.
You do great questions, really. Because I can see that you are totally in tune with that, and it was exactly what I was thinking at the beginning. So at the beginning, when I was really, first of all, I was trained in cognitive therapy, and I was working with clients, and I was seeing that there were so many people suffering, so many, and then I said, okay, I'm gonna organize also trainings and workshops for other therapists, so they could learn new therapies and they could help more people. And so I was always thinking, how could I help more people? I could help more people. And then I thought, oh yeah, there are so many therapists and so many clinicians around, but so many people are suffering, and we are losing the game. We are really, I mean, the pain, the suffering is increasing, even if we are so many therapists trying to help.
Yeah. There are so many more pressures and demands on people and society.
Also because many people don't go to therapy. And so many people don't go to therapy, and in the sport field, how many do you think are really going to a sport psychologist?
Yeah, not many. And it's quite eye-opening when you hear the ones that are.
Yeah, exactly. But if I think what we are able to do, we are capable to do, I'm always trying to say to people on the social media, look, this is possible, this is possible. And but I can see that they are not considering the possibility to go to a psychologist. They think, oh, no, there's something wrong with me, but there's nothing wrong. I mean, we need help. We need help. We need someone that knows how the brain works, how the personality works, and then try to be helped. And then we could achieve things that are incredible. And so I was saying, so many people are suffering, and I thought, oh, we have to find something that the people can use at home without the therapist. So if you do a few sessions and you do some many experiences in front of the mirror with a therapist, then I now usually give a dot to the client, and I say do exercises at home. So they can do exercises. And in this period of lockdown, I'm working with several athletes, and it was the first time that I was trying using the mirror, even if we are in lockdown. So I'm here, and they're at their place. So they have a mirror, and we do the sessions in which way? They took the computer or they took the tablet, and they put the tablet that is facing the mirror. So I can see them in the mirror, and they can see me in the tablet through the mirror. So I guide them during the practices. Obviously, it's not the same thing, but it's a good thing. And then I'm giving them practices to do. Like there's a very, I think she's going to be, in the future, she's going to be one, probably the best polo vaulter in the world. I think she's so great. And she was already in the representative of Great Britain. And she's young. And she's working so well. So she's unbelievable. And she's doing all the exercises that we are saying in front of the mirror. And she's doing it by herself. She's training every day by herself for the usual training that she does, but also she's retraining mentally. And she's saying, oh, I can see how it is affecting the way I'm training myself. It's totally different. Wow. And she did some competitions before the lockdown. And she said, wow, I was much more confident.
I feel like it's like a new form of being in the zone, in quotations, that people almost get into. It feels like you're able to access that bit between the conscious and the subconscious, and potentially train that further.
Yes, absolutely. I think so. I think you said exactly the right thing. I think we are giving them the tool to get into a specific dimension inside of themselves, so they can be totally focused, and then also positive and negative, they becomes like an expression of the same thing. It's not, they are not so relevant anymore.
Yeah.
So because we live in a society in which we are really trapped in the myth of positive. So we are always trying to achieve positive, and we think, we need to feel this. But actually, there are two faces of the same coin: the positive and the negative. When you are it's like a drug. If you are addicted to the positive, then when there's something negative, you are totally, or if something is not perfect, you are totally stuck in that place. So with this, you are like in a dimension in which you are free, and you feel, oh wow, I can really be here. And so with the athletes, we talk about being in the flow when you need it. Exactly when you need it, you are there. And it's like, from athletes, like what I can see is that they created a career, they became professional, but sometimes it's like a castle made of sand. Because the motivation was really trying to manage something that was negative inside of themselves.
Yeah.
And that is the motivation that really pushed them. They feel, oh, if I let the control on that, I will lose. Yeah. But actually, it's the opposite. That is what is really making them living in a jail in which they cannot enjoy what they are doing, and they cannot really express their passion as they have it inside of themselves. Because it's more trying to manage something negative.
Yeah, that fear of failure.
Yeah.
And the fear of it stopping, and the fear of the ego being wounded, and all of those things no longer would exist, but like you say, replaced with a much stronger version of a like a neutral, almost like a very strong power. There would be a neutral power.
Yeah. And I think this is what we are really trying to do. Is something that should be natural, but because of our society, because of all the problems of the people that are really raising us up when we are children, it's really that evolution goes to another direction. So you stop at a certain moment to evolve in a positive way, and actually we are really putting them again on the track. And say, okay, yeah, wow, this is what you can do. So what they are doing is to do like a session of training or a portion of session, and then work in front of the mirror, session of training, I'm talking about the athletes at home, and then working in front of the mirror. So we are trying, remember what I was saying at the beginning, that we are trying to put the ingredients at the right moment. So they are doing the training and then put the right ingredient, doing the training and then put the right ingredient. Yeah. And this is going to shape their brain, is shaping their brain. And I have a person that is an athlete that actually is the representative of South Africa, and he's going to be in Tokyo. And he's great. He's doing great. And in these few days, he was training on trying to lift more weights. You can say, oh, this is not mental. This is just physical. You need to. So he started to do, before the session of weights, he started to do the exercise. Then he did one session of lifting weights. And then he said, okay, I just speed up a bit the practice in front of the mirror. So he was doing the movements of the eyes very quickly. And he tried again another session. Wow, what is that? I'm lifting much more weights. And then the last session that he was supposed to do less, he did it very easily with more weights.
Wow.
So that was incredible. Mind. Yeah, I mean, there are many different examples of this. Obviously, if one person comes to me and even if the person is a professional athlete, but I see that this person has psychological problems, like anorexia or something, or
some trauma,
or trauma, Then I work on that, and then I work on the performance. Because if I don't work on that, we cannot be free to work on the other things.
Yeah. I was going to ask that because obviously it would work really well for non-athletes, but people who obviously have suffered some sort of trauma. But also, presumably, if an athlete comes to you, that's what you're saying, isn't it? That you're working with the whole of their psyche, not just what's geared towards their performance, but any of the negatives that have come up through other traumas or upbringing or any of those things almost need to be ironed out for you to be able to then take them to the next level, right?
Yes, exactly. We have to remember they are not only professional athletes, they are also human beings, and so so the thing is that they had a childhood, they had bad experiences, and for many massive number of them, the reason why they were really training so hard was because they were trying to escape from something else. But it was it doesn't mean that it was negative. I mean, they survived. They survived. That was really good. But now, what does it show that? It shows that they have incredible qualities, and they became professionals because they have those incredible qualities. But they became professionals despite they were training in that way with that kind of motivation. What I say to them, look, what you achieved is not because you were treating you so badly, but what you achieved was because you have great qualities, and you were able to achieve those things despite of all of this. So what I try to do is to really make them able to live something different and have a different kind of motivation, and see that they can achieve more if they let the control go a bit. So it's really exciting. It's something really exciting because I can see the how they change their facial expression and how they start to perceive things and how they start to enjoy what they're doing. So it's really nice.
Wow. Oh, like obviously it's brilliant that you're still able to do it during lockdown, but I bet you cannot wait to get back going.
Yeah, absolutely.
Again.
Absolutely.
Because it must be amazing having you both in the same room at the same time. The energy must be incredible.
Yeah, it is. So I miss that a lot too, because it's not just something that is happening to the person that I'm working with, but it's also something that is happening
of course,
to me.
Wow.
Yeah. We are both part of the same process.
Yeah. You must build very strong connections then with your clients.
Absolutely. This is something really important. I just linking what I'm saying to what you just said is why we call that mindful the therapy. We call it Mindful Interbeing Mirror Therapy.
Of course.
Yeah, because when I was training mindfulness by Zinder Stiegel and Mark Williams they've been working developing a protocol that was meant to help clients to prevent relapses in severe depression, in chronic depression. So they were trying to prevent their relapses with this. So I was trained by them, and I've been using mindfulness for many years, and what I saw in front of the mirror was something really special was happening. So we were really connected to our we were connecting between the two of us. But not only that, the clients started to feel connected to everything. Yeah. Like they started to give importance, value to everything. So they started to really feel more connected to plants or animals, or start to care about the world around it.
Yeah.
And they started to feel to live in a safe world, in a safe universe, actually. So everything started from a dot in the mirror, and then and then between the two of us, and then they started to feel safe in the field here in my private practice, and then they started to feel, wow, we are in a world that is safe. So I was really going deeper in what Thich Nhat Hanh was a monk was talking about, and he created this word that is interbeing, that is created by two words actually, inter and being. So I felt, oh, this is it. This is what is really happening. They're starting to feel the interbeing. They're starting to feel that they are interconnected with everything. We are all interconnected. So that was really unbelievable. And I have to tell you that I did so many hours of practice by myself in front of the mirror. And it's unbelievable. It's really unbelievable.
It must really heighten. It's like taking mindfulness to a whole new level. It must really heighten your awareness.
Yeah, absolutely. I am able to do things that I was not even able to think about before. And I discovered something. I discovered that actually the monks in the ancient ages, they were used to do practices in front of the mirrors. And actually, these are like deep practices. And I was talking with a friend that is really, he was a monk actually, and he said to me, Alessandro, you should really go deep into that, because this is unbelievable. You're doing exactly what they were doing.
Oh my God.
So this is something incredible, because everything was started from my idea. When I was a child, I was 5. My parents were getting divorced, and I was crying, and I was desperate. So I was used to go to the bathroom and close the door and just crying. I was desperate, and I was by myself. I was alone. And then I was just look into the mirror and cry, and then slowly, gently stopping crying and feeling better, because there was someone for me. I was not alone anymore.
Wow.
And that was the beginning. Then after many years, I had this intuition, and I did it. And it was everything started from what I felt was good. And then I tried, and then it was incredible.
That's
obviously
amazing. So I suppose that's like a development of self-love as well, isn't it?
Yeah, self-compassion. Yes, yeah. Self-love, self-compassion. Yes, it is. And obviously, I told you that they can do exercises at home, but obviously it's much better when you are with another person. You can connect with that person.
Yeah.
So you really, because you expand your awareness, you expand your capacities when you are with another person.
Yeah.
So you become like a diet.
Yeah.
You have like a client of mine said to me, Alessandro, it's so strange. This is the first time that we are meeting, and I'm in front of the mirror, and I feel as if you were an extension of me.
Yeah.
An extension of me for some clients. Can you believe that?
That's amazing. That's making me think. There's a really there's an amazing picture where the two brains, and there's like this blue smoke almost connecting them. I'll have to find it. It's making me think of that for some reason.
And so I was saying, when I did many hours of practice in front of the mirror, and then I met with my colleague. She's in Genoa. Her name is Marina Cirio, and she works in Genoa. I met with her, and I trained her in what I was doing, and then we worked together. We were always talking. She was working in Genoa, and I was working in my private practice. First in Sardinia, because I was used to live in Sardinia, and then in London. And we did hours in front of the mirror together. And I remember the first time I did like 3 hours in front of the mirror with her.
Wow.
And after that, I was feeling something that I've never felt in my body, in my brain. That was like I was feeling that I was loving everything and everyone, and I was feeling also the world that was all around me. So I was feeling the universe, the world also here on my back. If you think about, we think that we have a three-dimensional view, but actually we live like in a bidimensional world. We always live like as if it was a scenario that we are seeing in front of us, like a big screen in front of us. With this practice, you feel that you are surrounded by a universe. And so I was feeling a lot here, because the therapist usually standing. I was sitting down, and she was standing here. And then after that, I was also feeling something that when I say that, then it becomes like a joke, and people start to say, I want to feel that, I want to feel that. Then the closest way to describe that is, it was like an orgasm, but without the sexual. And it lasted for a few hours.
Wow.
So it was, why it was that? It was like an activation of certain areas of the brain that are related to dopamine. I was feeling like something, but it was good. It was not. It was really
not
fulfilling.
Not seedy, just nice.
Yeah, absolutely.
Tantric
Totally
positivity, tantric mindful interbeing.
Yeah, without sex.
Yeah.
But obviously, it doesn't happen every time. I mean, obviously you need to, for have something stronger like this, you should stay for a longer period and
yeah.
But it's not always like that. But actually, I can go just for what we are able to do in 1 hour.
Yeah,
it's just enough. That it's okay. It's very good.
That's amazing.
It's incredible.
Wow.
And I'm really looking forward to be able to try also with you in front of the mirror, and so you can feel it. You can see how because when I describe that, people could say, "Oh, yeah, he's lying. He's saying things." But you just have to try. When you will try, then you will say,
yeah,
how you feel.
So, what's the best way for people to get in contact with you, or book a session, or find out more?
So actually, I have 2 different websites. Actually, I have more than two different websites, because the fact that I'm Italian, I have a website for Italians that is more related to the clinical for patients, persons that are suffering, and it's and then I have a website for clients that are suffering, patients in English, and then I have a website for professional athletes. So the simplest one to say is mirrortrainingmethod.com. This is the one for the athletes, and the other website to book an appointment. So, I mean, if everyone could go to the Mirror Training Method
and contact you
and contact me from there, because My email address is info@mirrortrainingmethod.com.
Right.
So with that email, they can contact me, or they can also send me a text message if they want on my phone. I mean, my phone is public. I don't have
that. And so would you recommend that people wait until after lockdown to have their first session with you, or is it something that people can try?
I started actually new sessions with new clients. During this lockdown, so people are contact me because they're starting to feel very affected in a negative way. So they need help. They need, and with the athletes, it's a bit like they are, all of them are trying to train.
Yeah.
So
it's definitely not stopped for them.
Yeah, we could start to know each other, and then obviously meeting in person will give us more opportunities to work for achieving the goals.
And then normally you're based in London?
Yeah, I'm based in London, but I travel and I go around because sometimes so I have two kind of especially for the athletes. Athletes, what I do is work online. So I work online. Obviously, if I can work with a mirror, I work with a mirror. Otherwise, I work online also with other procedures. But every time we can, we meet in person. And sometimes what happens is that if there's a very important competition or they're going to stay away for a while, sometimes they ask me to go and do like an intensive training. Like I call that training, but actually an intensive practice with them for a longer period, and then I come back. So I can go to Spain if I need to go to Spain with a tennis player, or I can go to Germany if I have to work with a football player, and so on. And it happened also to go to United States, but then I was going there for trying to combine many different things. Obviously, if I do that for professional athletes that can really afford that, because obviously it's going to be expensive for me and for them to do that. And but I always try. What I try to do is to. I didn't say to you that I've started here in London to work with young athletes. So I'm always trying to really be more focused on the goal that we want to achieve instead of seeing this thing like a big business that I have to make a lot of money. So if I see that there's a young athlete or an athlete that is trying to achieve different levels but is still not earning so much, then I can really adjust what I do and the fee that I take from them. But with professional athletes, obviously, I'm giving them the possibility to achieve a different level of performance. So for them, it's something so important that it's so worthy.
Amazing. I can't wait to come and do it.
Yeah, me too.
It'll be so much.
It's gonna be.
It'll be so interesting.
Yeah, and me too. I really. Sometimes the good thing is that I have a garden, so I can go out and I can stretch and do some exercises and but I really cannot imagine how difficult could be for people that are really staying
really
in a tiny place. And
we're very lucky we've got a balcony, but I think I really sympathise with people who are stuck in a flat and can't get out,
and especially in this period that we have so nice weather.
I know. It's like the universe though is going, thank you so much for just giving me a break. It's like paying back good stuff in tenfold. I think the universe needed some rest as well as us.
So it has been a very incredible pleasure for me to speak with you, and I think what I can say is that you are really in tune with what I was talking about. So you know exactly the right questions, and
good.
It was like prepared, but actually we were just meeting each other now and talking.
Yeah, that's good. Thank you.
Yeah, and I also want to say something. I want to say that I will be able to attend to one of your yoga classes.
Yes.
Yeah, I'm really curious, and I need to be able to do that.
Yeah, definitely. Let me know when you want to, because you've already paid for one, so don't pay again. Just let me know when you want to come, and then.
Okay. So all the best to you.
Thank you, Alessandro. You too. Have a lovely afternoon and stay safe.
Yeah, you too. Bye-bye.
Bye.